Hi everyone. Today we'll discuss about few MCQs about Meckel's diverticulum. All are true statement about Meckel's diverticulum except. So we need to identify the false statement. So occurs in 2% of population. That is right. So Meckel's diverticulum is seen in 2% of population within 2 years of age. Most commonly seen within 2 years of age and 2 2 inches in length, that is about 5 centimeter, and 2 feet from the ileocecal junction, that is around 45 to 60 centimeters. So perforation can occur. This is because there is heterotopic gastric mucosa, which is most commonly seen, and it is seen on the anti-mesenteric border. Yes, and it contains ectopic gastric tissue. Diarrhea is not common. Hemorrhage is the most common. So this is the wrong statement and this will be the correct answer. So here, if there is hemorrhage, is the most common symptom. Second question. Meckel's diverticulum follows the rule of 2. So which among the following is false? So occurs approximately in 2% of population. This is the right statement. Approximately 2 inches in length, that is 5 centimeter, correct. Generally present 2 feet proximal to the ileocecal valve, that is also correct. 2% are symptomatic. No, that is wrong. So the answer is D. Ectopic mucosa of the Meckel's diverticulum is diagnosed by the ectopic gastric mucosa is mainly picked up by the technetium-99 radionuclide scan. All are true about Meckel's diverticulum except. So it is congenital, yes. True diverticulum because it contains all the layers of intestine. So it develops from the omphallomesenteric duct, correct. All incidentally detected Meckel diverticulum should be resected. So all Meckel diverticulum need not be resected. So it depends when at what age it is detected. So whether it is symptomatic or asymptomatic. What is the risk of malignancy? Is the patient having intermittent bleeding? All these factors will determine the removal of Meckel's diverticulum. Otherwise, no. The most common presenting complication of Meckel's diverticulum is, as I already told, it is hemorrhage. What does intraoperative photograph depicts here? So when we see this photograph, so it is a bowel. How do you differentiate whether it is a small bowel or large bowel? So there is no tinea, or there is no hostrations, or there is no appendices epiploicae. So this is a picture of small bowel. So when it is a picture of small bowel, so transverse colon is ruled out, fallopian tube is ruled out. So you can see there is a bulge in the anti-mesenteric border. So here can you see the mesentery? So this is the mesenteric border and this is the anti-mesenteric border. So the pathology arising from the anti-mesenteric border, which is given here, is Meckel's diverticulum. Meckel's diverticulum is a derivative of vitellointestinal duct. The most frequent congenital anomaly of the GI tract is the Meckel's diverticulum. So all of the following are true about Meckel's diverticulum except. So there is bleeding because of the ectopic gastric mucosa. It can cause intussusception. It arises at the mesenteric border. No, it arises at the anti-mesenteric border, located 60 cm from the ileocecal valve. This is also a true statement. So the correct answer will be C. Which one of the following statement is incorrect regarding Meckel's diverticulum? So it is found on the anti-mesenteric border of the small intestine. Yeah, that's a true statement. So consists of a mucosa without a muscle coat. So we know that Meckel's diverticulum is a true diverticulum. So if it is a true diverticulum, there will be a muscle coat. So this will be the wrong statement. Heterotopic gastric mucosa can ulcerate and cause brisk gastrointestinal bleeding. That's a true. Fibrous band between the apex, that is like when you have the umbilicus, there can be a fibrous band arising from the umbilicus to the apex of the Meckel's diverticulum. So this fibrous band can cause intestinal obstruction. This is also true. So the answer is B. Best investigation for the diagnosis of ectopic gastric mucosa in Meckel's diverticulum is radionuclide scan. A wide mouth Meckel's diverticulum is found accidentally on laparotomy. So what will be the treatment of choice? So it's a controversial question. So the answer is resection of diverticulum. I already told. So it depends on the future complications and the malignancy risk, and the most common malignancy arising from Meckel's diverticulum is neuroendocrine tumor. So resection of the diverticulum is the correct choice. Complications of Meckel's diverticulum include hemorrhage, yes; intussusception, yes; it can cause even strangulation, yes; if it is a part of hernia, it can be inguinal hernia, it can cause Leiter's hernia, and it can undergo strangulation. So all the options are correct. The option is D. So which one of the following condition is diagnosed by technetium 99 pertechnetate scintigraphy? So pharyngeal diverticulum or the Mcqs diverticulum, you use barium, swallow. Duodenal diverticulum, oral contrast, CT. For this you use barium, swallow. For this you use oral contrast, CT, and colonic diverticulars are picked up at the colonoscopy. So only thing diagnosed by technetium pertechnate scan is Meckel's diverticulum. The Meckel's diverticulum is situated within how many centimeters from the ileocecal valve? It is usually 60 centimeter. Which one of the following statement is not true about Meckel's diverticulum? So it is the most common congenital anomaly. That's the true statement. The most common is ectopic gastric mucosa. Yes. It can also harbor pancreatic mucosa. Bleeding can occur from the wall because of the gastric mucosa. Yes. Wide mouth stapling at the base for non-bleeding cases. So it is done for bleeding cases. That is the removal of Meckel's diverticulum. So this is the answer. Uncommon complications of Meckel's diverticulum. Intussusception is seen, diverticulitis is seen, increased bleeding. So malignancy is the uncommon complication, and the most common malignancy is neuroendocrine tumor followed by adenocarcinoma. So it's given in Sabiston. Common congenital anomaly of midgut is Meckel's diverticulum. Efficacy of technetium pertechnate scan is increased by all except, so it is increased by glucagon, pentagastrin, and cimetidine, which is the most commonly used. So which is not increased is metoclopramide. That's the answer. So what is false about Meckel's diverticulitis? Present in 3% of population. So no, it is 2%. And presence with periumbilical pain, yes. Remnant of proximal vitellointestinal duct, yes. Yes, and lies in the antimesenteric border. That's true. So the answer is A. Thank you.